All right, Sherry Gage, now we're going to do the progress report. And you know this isn't my strong suit, so we've done this all in one morning. This is why we're in the same woo-woo dress and, So here we go. This is your integrity management, Dr. Lux, your star host, going through what's called the progress report. And are you ready? Hi, Pam. It's so good to see you again. How are you?
Dr. Lux, fine, thank you.
Oh, you got you through your exam this morning, got through your therapy. Everything doing okay?
Everything's great.
It's good to see you. You know, it's been amazing the last couple of months. You've been just cruising along, everything going perfect. From the bottom of my heart, I got to tell you, I appreciate you as a patient. You make my job easy. I could see 1,000,000 patients a day if they all did what was instructed. I've got to tell you, you're doing really good. We're here today because we're in the final phase of care before wellness, strengthening phase of care. And I just want to tell you that, through your physical examination findings today, I want to report to you that I've got nothing but good news. All blue skies ahead. So I want to go through this with you, and I know we've talked about this before. I know I've talked to you 3 or 4 times about this, but it's important enough to discuss 100 times because at the end of the day, this practice is so phenomenal because half the people that walk in here are on wellness supportive maintenance care. They've got debilitating injuries, but they're not having anywhere near a debilitating life. Like we've discussed, this is a pre-surgical potential for your neck because of the compression of the neck and the radiating arm pain. The arm pain, from what I understand, is significantly reduced. From what they tell me with your exam, your range of motion was about 5% of normal. Your neck pain in the beginning was a 10. Your right arm pain was a 10. 80% improvement with your range of motion in your neck. Phenomenal. 20 years old, 21-year-old kid is what you got now. An 80% reduction in your pain. It was a 10 and now it's a 2. Making your overall percent improvement 80%. We're in that final portion of this before maintenance where we're going to show you how to strengthen. The strengthening phase of care is very, very important. We've shown you this chart a couple of times. We're increasing energy and function, increasing strength and further mobility. There's a little bit of mobility that we can still get out of that neck. We're strengthening the muscles and the ligaments. We're trying to get that neck to have optimum health. Towards that end, we are almost there. This is the alignment part of this, and we've gone through it, and you're doing very well. The preventative care part of this actually saves money. If we would have caught you when you just started having this problem, the only thing we would have had to have done is supportive care to it instead of all this work. As we go through this, it's the same thing as weight loss. As if you lost 50 pounds, I'm going to do my best to make sure you do not put that weight on again. Preventative care saves money, it saves time, and you deserve to have your neck moving fully. It's one of the major disabilities in this country. If we can get you to the point over the next 8 weeks, we're going to be doing weekly visits with you. We've given you all the exercises this morning to start strengthening your neck. I want to remind you to continue to do a little bit of ice. I want to remind you to continue to do that stretching program that we taught you. And now we're going to incorporate that strengthening portion of your care. It's so important because what you're doing over these next 8 weeks, and you'll continue to do these exercises at home, is that you're going to take those muscles and you're going to take those tendons and those ligaments and you're going to tighten around that compression so it stops being compressed. Gravity's never going to stop. So we want to make sure that you understand these things, and we want to make sure that you understand the most significant part of what we're doing right now is getting that neck to be a little bit stronger. We talk about who taught you how to take care of your teeth, and who taught you how to take care of your hair, and who taught you how to brush. This is us teaching you how to strengthen your neck, and nobody's ever going to teach you how to do this. And that's why we want to make sure that you get to that preventative, supportive, maintenance part of your care that's just so important because this is too timely and too expensive to do again. That person that loses 100 pounds and they go back and they put that back on, oh, so hard on the body, so frustrating of an experience. They're going to be dropping your schedule down to weekly visits. The focus is strengthening. If you have any questions at any time, do not hesitate. When I first met you, I said this consultation is ongoing. It never stops. So please ask questions. And at this point, I just wanted to ask you, is there anything else we could be doing for you? Is there anything that you feel is missing from your care? And I also want to congratulate you on doing such a great job. An 80% reduction in a matter of 6 weeks with a problem that could have went to a surgeon and got cut on 2 months ago. It's amazing to see. So is there anything that we're missing from your care at this point? Any questions that you have?
No, I don't have any, but I feel confident that I can ask them at any time and get answers to whatever questions or problems I have.
Really.
And your staff is absolutely wonderful. I love them.
Yeah,
They laugh all the time.
they're a good bunch. Very well trained, and they're hard working. And as you know, we put in sometimes 10, 12-hour days. If there's anything you need, this is for you, just so you have it. And there's some information in there. And I'm gonna miss you. I've enjoyed seeing you, and it's a lot nicer seeing you healthy than to see you in pain. But I'm gonna miss you. As we're only seeing you weekly, and as we get to those monthly supportive care visits, it's gonna be a pleasure treating you. It really has been, and I'm sure it will continue to be. And again, if you have any questions, don't hesitate at all. Okay?
Okay.
They'll be right with you, and they'll get you out of here in just a second. Okay?
Thank you very much.
You have a great weekend. Happy Father's Day to you.
Thank you.
Headshot.
Your staff is wonderful.